Amiodarone or cortisone. Classification: antiarrhythmic or a class 3. Action: it acts directly on the myocardium to delay repolarization and increase the duration of the action potential. Basically, it's trying to slow things down from a ventricular standpoint. Indications: ventricular dysrhythmias, second-line agent for atrial dysrhythmias. Adverse effects: patient may complain of a burning sensation at the IV site. They could have hypotension and bradycardia. Contraindications to using amiodarone: a patient with sick sinus syndrome, basically a slow heart rate, any second or third degree heart blocks, cardiogenic shock, when episodes of bradycardia have caused syncope, and any sensitivity to benzoyl alcohol and iodine. Dosage: ventricular fibrillation and pulsus ventricular tachycardia. The adult patient will receive a 300 milligram bolus IV or IO. It may be followed by a one dose of 150 milligrams in 3 to 5 minutes. After converting your patient, follow with a 1 milligram per minute infusion for 6 hours, then a 0.5 milligram per minute maintenance infusion over 18 hours. Pediatric patients should get 5 milligrams per kilogram for a max dose of 300 milligrams, and you may repeat 5 milligrams per kilogram IV or IO up to 15 milligrams per kilogram. Relatively stable patients with arrhythmias, such as PVCs or wide complex tachycardias with a strong pulse. Adult patients should get a 150 milligram and 100 mLs of D5W IV or IO over a 10-minute period. You may repeat in 10 minutes up to a maximum dose of 2.2 grams over 24 hours. Pediatric patients should receive 5 milligrams per kilogram very slow IV or IO over 20 to 60 minutes, and you may repeat in 5 milligram per kilogram doses up to 15 milligrams per kilogram for a maximum dose of 300 milligrams. Special consideration: this is a pregnancy class D.